Hi everyone, I'm Helen from Hilton House Medical and I'm here with Luke today, who is one of the patient coordinators at Hilton House. And we're here to discuss all about winter, aren't we?
Yes, we are.
So I should start by saying Merry Christmas, Luke.
Merry Christmas, Helen. How's your Christmas shopping going?
Oh, dreadful.
Dreadful.
I'm one of those that does most things kind of last minute. How about you?
I've still not finished mine yet. We went to an antique shop yesterday and bought some bits.
Oh, nice.
Yeah, it was very nice. But yeah, I've still got loads left to get.
And who does the wrapping, you or someone else?
Usually me. So I'm going to have to put a day aside soon and get it all done.
Make sure you've got enough sellotape. That's a tip.
So we're looking at all things to do with winter and health.
Yes.
So I've gone away and I've done a bit of research.
Yeah, brilliant.
So lots of topics to talk about.
Yeah.
The first one really is about respiratory infections.
Yeah.
Which is kind of the main one, I guess. The flu that's what everyone talks about. That's the one that everyone seems to at some point get.
And at the minute it's rife, isn't it? Yeah. It's everywhere.
Yeah, it's always rife this time of year.
Yeah.
So you've got a lot of flu going around. COVID is still a thing as well.
People often forget that, don't they?
Absolutely. But it is still a thing. It's still going around. It's not taken in quite the same way as it was a couple of years ago. But it can still be quite serious.
And all the usual rules apply, don't they?
Yeah,
Keep washing your hands.
Yeah, washing your hands, just having general good hygiene. And if you are getting saddled with any of these illnesses, try and isolate yourself where possible.
Yeah. But it's hard with children, isn't it?
It is, yeah, it is. It's really difficult with kids. And a lot of the time, it's the kids that are bringing this stuff into the home.
Absolutely. I've never been so ill since I've become a mum.
Yeah, exactly. Yeah. It's going around lots and lots. And it's not just, a lot of people sometimes just think it's a common cold.
Yeah.
And it's not too much of a big deal. And sometimes that is the case. But a lot of times, especially this time of year, it can lead on to much more serious illness if you're not careful. It tends
to be the people that are most vulnerable, doesn't it?
Yeah, absolutely. Anyone with any chronic conditions, anyone who might have a compromised immune system, or they're a little bit older, it can really hit them quite hard.
Yeah.
So for Hilton House, what we can do is we can look at flu jabs.
Yeah.
Now there is quite a large shortage of them at the moment. I know we were looking at getting some this morning for a patient, but we'll ring round every single pharmacy that we can find until we find somewhere that's got it.
Absolutely.
Or we'll always have a really good idea of, if we can't get it today, when can we get it by?
Yeah.
So we can deal with flu jabs, general doctor's consults. If you've been suffering with it for quite a while and things aren't getting better, or maybe it's progressing to more of a chest infection or something like that, or even if it's just an initial thing and you are concerned, we can do a GP consultation, no problem at all.
And I think what's good here as well is that if you come for your GP consultation with ourselves, don't think you'll be sat in a waiting room with like 30 other people.
Yeah.
It's quite, it's a select number of people, isn't it, that come in, and the appointments are very staggered, so that usually you only see one or two different people at the same time.
Yeah.
So that's good. You're not in that crowded environment.
No, exactly. It's one of the benefits of, in some ways, having a smaller service, is that we don't have loads of people in the waiting room at all times. We've got other things that go on, but usually the building isn't crammed full of people.
Yeah.
There's no crowded waiting areas. And then moving on, the next one as well, norovirus, which tends to start cropping its head up around this time of year. So if you don't know what norovirus is, it's what they call the vomiting bug. So the two main symptoms are vomiting and diarrhea. Ideally, you want to isolate yourself for 48 hours after the first signs of these symptoms. But sometimes it can carry on and it can go on for a little bit longer, at which point you might want to get booked in with a doctor.
Yeah.
We'd never recommend coming in if you are actively being sick or having those symptoms.
Yeah.
But if they do start to subside and you're still not feeling like you're getting back to where you were before you caught it, get in touch. We'll get you booked in and get you seen too. A lot of this stuff as well, you might need to take time off work.
Yeah.
So for fit notes, fit to work, again, we can sort all that out for patients, which I know sometimes can be a bit tricky with other GPs.
Yes.
Whereas we don't find it tricky at all. If we can sign you off work, then we will do.
Yeah.
Yeah.
Okay. And the thing about all of these aspects that we're talking about is that people often think, well, this just applies for the colder months, November and December.
Yeah.
But actually, it runs on winter up to March, doesn't it?
Yeah, really. Yeah, absolutely.
I just feel that from experience, it kicks in more then. That period between January and March is when a lot of people are ill.
It's a lot, I mean, it's all the kids go back after their Christmas break or winter break, and that again you see a surge of these things cropping up. So we do get quite a lot of patients coming in with these sorts of symptoms. And again, 99% of the time, it's nothing major. It's a flu. It's maybe it's just a common cold, or maybe it is COVID or something. But best to make sure that it isn't something more serious.
Yeah.
Just popping in and having a consult, we can get that sorted.
Brilliant.
Yeah. All right.
Okay.
So what have we got next?
Oh, some of my favourites.
Yes. Yeah, we've spoken about this before. So, around Christmas time, food and drink issues. So, food poisoning. Food poisoning, it trends upwards in winter.
Are you saying my cooking's bad?
No. I've never had food poisoning from your cooking.
No.
But I've never eaten your food, so that's probably why. It's just a case of lots of people cooking lots of dishes for things, maybe like a work event, bring your own dish to that. Yeah. Or you're going around to your parent-in-laws for Christmas dinner and you've never really had their food before, or anything. It's just there's lots of food being made and prepared. It's just a game of odds that it's more likely it's going to go wrong if more of it's just being made.
And it's that thing about the following day, Boxing Day, when you've got leftovers. Yeah. What you can warm up and what you can't. I think that's when a lot of problems can arise from that.
Again, majority of the time, food poisoning, it's not a major thing. It will subside after a little while, but there are certain types of food poisoning that can be quite nasty. And if you feel like you've eaten something and you're having some really nasty symptoms for quite a few days, then we need to have a look at that.
What's this here? Campylobacter? Is that how you pronounce it?
Yeah, Campylobacter spikes every Christmas. Again, it is a type of food poisoning. It's a bacteria that causes certain types of food poisoning. Yeah. They all go up around Christmas time. Another thing that does go up around Christmas time is allergy testing. Tends to be that a lot of younger kids might be getting exposed to foods they've not tried yet around Christmas time.
Yeah, true.
So
I think us parents we're like that, aren't we? Oh, just give this a try.
Yeah, try this
because this is different.
Absolutely. And sometimes there's things you never really thought about. I'm thinking prawns in a prawn cocktail. That's quite a common one. Pates, nuts in maybe a nut roast, or your stuffing, chutneys. All this sort of stuff that kids, maybe this is the first time trying it, and they come out in some horrible rash or goodness knows what else. We start to see a spike in allergy testing. Again, allergy testing is an interesting one. We do allergy testing, no problem at all. But with the way it works with the blood tests, the more you can narrow down what you think it is, the more cost effective it is. Allergy is a really tricky one where if you come to us and say your child or yourself has had an allergic reaction, but you don't quite know what it is, our labs do offer tests that do a wide range of allergen testing, but it's very expensive.
Is it sort of, is it just a simple blood
prick?
Yeah.
It's just a standard blood test that's conducted by our phlebotomists here. I think for an individual allergen, it is £40.
Yeah.
And then every single one on top of that is £25. So if you say, I came in and on that day I had milk, eggs, and prawns, we can test for those three, and it's going to be 65, around £80, between £80 and £90 off the top of my head. If you come in and go, I'm not sure what I ate, but I've had a reaction, you could be looking in excess of, £400, £500. So we really want to try and narrow down what you think you've had a reaction to.
And are there any age restrictions on blood tests?
There are no age restrictions, but the younger someone is, the more risk there is that we're not going to be able to perform the blood test due to, discomfort or the child just not being able to sit still while it happens, and that's totally understandable.
Yeah, it can be scary, can't it, for adults having a blood test.
There are also certain tests that can't be done on a child that's very, very young, and that's just because of the sample bottle size. So for very young children, we have to use a much smaller bottle for the bloods. And there are certain tests that require the larger bottle. So I don't know what those tests are off the top of my head, but I think the main ones, sort of the most common ones, can still be done.
Okay.
Yeah.
Okay. Right. Great.
Moving on then.
Another popular topic over Christmas.
Yeah. So we've covered the food bit. Now it's on to the drink bit.
Yeah.
We all know it's Christmas time.
Yeah. I think what's a really good tip is, obviously, people tend to do a lot of things to excess over Christmas.
Yep.
And if we're taking food and alcohol as the two main things, I think with alcohol, it's very dehydrating.
Mm-hmm.
So I think advice would be that if you are planning on and drinking a bit more over Christmas, make sure that you keep up with your hydration.
Yes. Yeah. Drink a lot of water.
And maybe take alternate drinks.
Yeah, definitely. So with the drinking stuff, if you've come to it and you've had a lot of drinks over Christmas and you may be thinking, it's becoming a bit of an issue for me, then by all means make a consultation. We're happy to talk about what the options there are.
Yeah.
It's not something we specialise in, but anything that we don't specialise in, so we don't specialise in things like mental health or addictions or things like that, but we are very good at signposting where to go. Yes,
absolutely.
And sometimes that's the toughest step, is knowing what service do I need.
Yes.
And we can still give advice and any sort of medical advice surrounding those issues. We can still do that.
Yeah.
As well as drinking to excess over a number of days. At the end of the day, it's going to do damage.
Yeah, you need to look after your liver, guys.
Yeah, totally. Go out and enjoy yourselves. That's absolutely fine. But just be aware that these things, do have a tax on your body.
Yes.
And so maybe over Christmas you might, be sort of carefree and doing whatever, but then come January and, life starts to go back to normal after New Year's and things like that. It might be worth getting a health check, seeing where you're at, seeing where your markers are. If you go for a well person check that we offer, get a full body, medical, see where your weight's at, see where all your blood markers are at. And then if you are looking, as a New Year's resolution, I'd like to get healthier, that gives you a great starting point.
Exactly. Yeah. Because again, I mean, we'll touch on this in a minute, but you know, that whole thing about New Year's resolutions, and typically, and I'm one of them that does it every January. Oh right, I'm gonna lose some weight. I'm gonna eat healthier. Start eating a bit more kale and all the green stuff. And by about March, I'm probably a bit fed up of it all.
Yep.
So I think it's great, and I'll be certainly booking myself in for that.
Yes. Yeah.
To find out where everything sits with me. So my weight, my cholesterol, my blood pressure, etc. So I can get a good picture before I go 10 to the dozen.
Absolutely.
Which is what I tend to do, and just fail miserably, and then feel back to square one.
Yeah, I think on that, it can be a really good motivation factor. If you start off with all this information of where your health is at the start, and then you look in 3, 4 months, 5 months time to come back in and have another one done, it can be quite tricky sometimes if you're not seeing your weight decrease on a scale to stay motivated.
They should be banned weighing scales.
Right. So if you can get as many markers that you can look at, then maybe your weight hasn't changed, but maybe your cholesterol's gotten better.
Yes.
You know, maybe your hip to weight ratio is better. Your body measurements are better.
Yeah, your body muscle as well. Right? Yeah.
Your weight might stay the same because you've put on more muscle and lost some fat, but just looking at a weighing scale, you don't know that.
No, so that's why the blood test that looks at all those biomarkers is brilliant, because it is different for everybody. And I don't think we should get too fixated by the data that's out there that's saying if you're this height, you know, you should weigh X.
Yeah.
Because it's different with your muscle. If you're building muscle tone, you're going to weigh a bit heavier.
Yeah, absolutely. Yeah. And then the final section of this lifestyle related seasonal issues part is looking at heart issues.
Yeah.
So it is true that, you know, heart attacks and heart issues in general again tend to spike around this time of year.
And we forgot to mention actually that alcohol raises your heart rate.
Yeah, this is totally linked into this. So heart issues to do with stress, you know, it is that time of year. I'm stressed. I don't know if you are.
Oh yeah.
But I'm very stressed about Christmas.
It'll be a swan.
Chaos under the water.
Yeah.
So yeah, it's the extra stress. It is the cold weather. If you've got any underlying issues, the cold weather does still tend to exacerbate them.
Yeah.
The big meals, the alcohol, the excess calories, you know, the damage you're doing to your liver, to just your overall system, really.
Yeah. And people sitting in cozy at home, central heating's on, TV's on. We're not really going out much because it's dark outside.
Absolutely.
Dark when you get up, dark when you come home.
Yep.
You know, so all those things lead to us feeling sometimes a little bit not ourselves.
Yeah, no, and you're not motivated. You're not motivated to move. This is why the heart issues are on the rise at this time of year. A couple of things we can do with that. We offer ECGs, so echocardiograms, so we can look at your heart rhythm. We actually have a member of staff who will take you in, put the pads on. You get all these different pads that they put on your chest, and then we take a sound signal of what your heart is doing, and then we transfer that over to an external facility. They'll then read the results, and we can have a result back in as quick as a couple of hours.
Wow, as quick as that? That's brilliant.
Yeah, there are a couple. You can choose your level. So if we don't need the results straight away, then we'll go for a cheaper option. But for the slightly more, I think it's 20 quid more expensive. So I think it's £60 and £80. You can get the result literally on the same day. It's really good.
Brilliant.
It's really good. I was surprised when it happened the first time. We got the result back so quickly.
Yeah.
We were amazed. The patient was amazed. It was great.
So it's like live streaming of your heart.
Yeah, pretty much. Yeah, straight away. We can look at doing something like that. But again, unless that's something you're particularly interested in, I'd recommend you'd have a GP consultation first.
Yes.
And then off the back of that, they would recommend whether or not an ECG is something to go for.
Yeah.
Yeah, and we can also do blood tests on heart health to look at blood markers as well.
Brilliant.
So lots of options if that is something that you're concerned about.
And if I need, I can see here inhaler checks and also medication reviews that we do.
Yeah, so we're looking now at chronic conditions, so managing ongoing issues and chronic conditions, which is something that we do here. Looking at if you've been at a GP for a long time and you've been on the same medication and you're sort of going through the same motions every single time and things aren't sort of going the way you would like.
Yeah, you're not getting any kind of advice that leads to a conclusion.
Yeah.
That, when you generally went in the first instance with a problem, it just seems to go on and on and on. You never get a final piece of advice that says, well, it's this.
Yeah. Yeah, a lot of time the doctors will look to sort of manage a condition but never look to improve it.
Yes.
Now, not every condition can be improved. But there are certain conditions where, there are some things you could do to make life a little bit easier for yourself.
Yeah.
But it tends to be that a lot of GPs are mainly just interested in, making sure that you stay at this level that you're at now.
Yeah.
Make sure you're okay.
It is true that they may well just recommend some medication. And it's not always a case that we need the medication.
Yeah, no.
There's other things we can do before we get to that point.
Yeah, totally. It always can help to get a second pair of eyes on things like this.
Absolutely.
If you're happy with how things have been going, then great.
Yeah.
But if you are concerned or you believe that maybe there might be a better way of doing it, but it's a tricky position, isn't it? Because you think there's a better way, but you're not a medical professional. You might not, because you're not a medical professional, you might not even trust your own instinct. We're always open to listening to what people say about their own bodies at the end of the day. And if you want to come in and discuss alternative options, we're happy to do that.
And I think the beauty of coming here is that you've got the longer appointments. So you can opt for a half an hour appointment, or you can even opt for an hour, can't you?
Yep.
So you're not feeling rushed.
No.
And you can obviously discuss things in a relaxed atmosphere in a modern space.
Yep. Looking at, we can do medication reviews. Like say, if you do have long lists of lots of different medications that you're on, whether that's ongoing conditions or maybe something a bit newer, then we can have a look at medications.
I think medication review is really important because sometimes the medication that you're on, it's counterbalancing, isn't it? If you're on different types of medication, you can often feel a lot worse, not better. So I think that's really important. If you feel that you're not on the right medication, or it's making you feel worse, or just not low energy, just not wanting to do anything, feeling tired all the time, get booked in with Hilton and they can do that medication review. Yeah,
it's another thing where it's really useful to get a second pair of eyes on it.
Yes.
It's really useful to get a second opinion. It may be that we completely agree with the medication that you're on. But we can look at, managing your symptoms that you're experiencing.
It could just be the dose, couldn't it? The dose is too high or too low.
All sorts of things.
Yes.
But like I say, a second opinion on stuff like that is really useful. Really, really useful. And we can do that.
Brilliant.
And then finally in this section is slips, trips and falls, which I hadn't really thought about when I considered, I don't know why I didn't think about it, but, illnesses or accidents that are happening around Christmas. Obviously, there are going to be more slips. There are going to be more falls.
I mean, we haven't got snow at the minute. We've just got a whole lot of rain.
Yeah, we've got lots and lots of rain. But even still, wet pavements,
and driving at night in the dark when it's throwing it down.
Yeah, absolutely. So similar sort of things that we talked about before. We can provide GP consultations. You may need to be signed off work for a little while if you've had quite a bad accident. Again, we can look at doing a fit for work note. If it is anything major, if it's a break or you really can't walk on it, I wouldn't recommend coming here. I'd recommend probably going to A&E.
Yeah.
But if it's just something that's maybe niggling, it's causing a little bit of pain, then by all means come in and see us. I think generally people know whether or not something is serious enough to then have to go to the emergency department with.
And even though we don't carry out scans ourselves here on site, we do work with outside companies, don't we?
Yeah.
That are local to us.
Yep.
So we're not asking you to travel miles.
Yes.
To go and get a scan if you need one.
Yeah, 100%. If you do end up going to the hospital and they need to do some diagnostic work, but you get told it's going to be a few weeks and you'd rather not wait that long, then yeah, come in and see us, and we can then signpost you to a private scan or private diagnostics that would be a lot quicker.
Yes.
Yeah, I think that's everything for slips, trips, and falls.
Yeah, brilliant.
Okay. So then, sort of the final part really is looking more at mental health.
Yes.
The main one that has, sort of not blown up in popularity in terms of more people are experiencing it, but a lot more people are talking about this, is seasonal affective disorder, or SAD.
Yeah.
And I totally understand it, to be honest. That lack of daylight can have a real effect on not only how you're feeling and your mood, but also your physical health.
Yes.
The lack of vitamin D can affect so many different things in your body and in your brain, that just taking an over-counter supplement can do wonders.
Yeah.
But
there are some foods that you can get.
Yeah.
I mean, if you're somebody like me that loves fish, then that's okay. But even though I mentioned that, the levels I'd have to eat a heck of a lot of it for it to get the levels that I actually need. Yeah,
it's very, very common for people to be deficient in vitamin D.
Yes.
A lot of people, we work indoors all day. You might not have the most balanced diet in the world, and it's just one of those things that's lacking, especially in the winter months.
Yes.
So we can definitely, that's where we can focus on, is sort of the background factors to maybe why you're feeling certain ways. We're always open, for talking and having a discussion and providing a space for people to come in and talk about how they're feeling. But we don't specialise in mental health.
No.
Like I say, what we don't specialise in, we're very good at signposting to the appropriate services.
Absolutely. But it's that whole Christmas thing, isn't it? I mean, for a lot of people out there, it's going to stir up a lot of old memories.
Yep.
And it can be difficult for a lot of people who maybe don't have that big support around them. Christmas time just isn't good for everybody, and loneliness is a big thing for people during Christmas time. So again, I mean, it speaks for itself, doesn't it, that we're a friendly bunch here, and you don't have to come and see us when you're physically ill. You can come and see us when you're well if you want to, and you just want to have a chat. That's absolutely fine. There's no judgment here at all.
No, not at all. And it's good, a lot of the patients that come in to see us, they're not necessarily feeling unwell at the time, but they can come in and get some advice on, things that are ongoing. Maybe there's something coming up in the next few months, or you're thinking about, I don't know, maybe you're thinking about a weight loss journey, or anything else really.
They're just going through a difficult time.
Or if you just, absolutely. Then, by all means.
And it's all discreet, isn't it? We don't have to inform your GP, do we?
There are a couple of situations in which we do. They tend to be with the diagnosis of quite a serious illness, something like cancer maybe. Then we do legally have to inform your NHS GP of what's going on.
Yes.
But for the most part, no, we can keep things completely separate. It's totally up to the patient. Some
Yes.
patients want everything on their, NHS record. Totally get that. Some patients would rather keep things separate. Totally get that.
Yeah. And do I need to leave my own GP practice if I want to come here to
Nope.
Hilton?
No, not at all. We work, in tandem with your NHS practice. There are certain things, we cannot really keep your NHS medical record. We can't keep that updated. We don't have somewhere to file it and store it. So you always have to keep an NHS doctor really to have things like that available. Sometimes if you do want to be referred on for a service, but you don't want it to be private, we still need your NHS GP there as an intermediary for us to sort of recommend you back to them and then make the recommendation that they then refer you on.
And it's keeping that NHS number, isn't it?
Yes, absolutely. So we still want you to keep an NHS doctor. If you are coming to see us, we wouldn't replace that service. Unless you're coming from overseas and you don't have an NHS GP, that's fine. We can still if you don't have an NHS GP, generally we can still treat you. But if you're a UK resident, really, we do want you to have your NHS GP as well as using us.
Brilliant.
Okay. And again, sort of like you were saying, stress, anxiety, loneliness, it all peaks in the winter months, whether that's just because it's darker longer, whether that's the sort of social situations that are happening around this time of year, the stresses of Christmas and New Year's and all the planning.
Yes, absolutely.
It's a lot.
We've put an awful lot of pressure on ourselves when it comes to Christmas.
Yeah.
And at the end of the day, it's just a roast dinner.
It is. It's just another day. It can be a really, really tricky time. And if you are struggling, just get in touch with us and we'll help as best as we can.
Absolutely.
All right. And then finally, I just wanted to have a look at sort of general patterns that we're seeing across healthcare over Christmas. So you're going to see that everywhere is busier. Your GP is going to be busier. We're going to be slightly busier. We won't be packed, but we will be slightly busier. Lots of people mixing, lots of, as we said in the beginning, flu going around and COVID or any sort of respiratory infections. This is why they're far more common. Everyone's inside, socialising, touching, eating the same food. It just becomes rife.
You often find that you're just pulled in different directions, don't you? Because you've got to go and see these people and see that people, and you don't want to upset that person or upset that. So you end up, I know it from myself when I've done Christmas days and hosted, that you often put yourself to the bottom of the list while you're looking after everybody else and making sure everyone else is okay. But you don't realise how, you're maybe getting a little bit run down, sleep deprivation, etc., and just doing too much generally over Christmas. So it's important that, we give ourselves a break.
100%. It can be really draining. If you are worried about your energy levels or how you're feeling over the Christmas period, again, give us a call. We can get you booked in. Another thing that we see that's going to be very, very popular is, as we were saying, New Year's resolutions. So as we go into January and start in January, you'll be seeing a lot of people asking about, exercise advice, weight loss advice, getting a full medical check.
Yeah, there's so much out there, isn't there?
Yeah.
There's so much online. People offering different things, take this supplement, but don't take that supplement. Always be mindful of what you're putting into your body, and that some advice online is never going to be better than actually sitting down with a fully qualified medical doctor. And in our case at Hilton, we're here for preventative healthcare. We want to keep you well, healthy and happy forever, or as long as possible. So, we don't want to be seeing you when, I think looking online, you go down a slippery slope, don't you?
Yeah, everyone does.
Yes, I'm guilty of it.
Yeah, I was just about to say I'm guilty of it.
I've done it.
Everyone does it. But really, if if it is a real concern, or you look at some advice online and you're thinking of taking action on that advice, always speak to a doctor.
Yeah.
Ideally us, but any doctor. Speak to a doctor before you go off and start making major lifestyle changes based on something you've seen online.
Absolutely.
You might be fine, but you might not. So,
I mean, personally, I thought I was doing everything right, eating healthy, losing weight, going to the gym. But actually, when I had a recent blood check, my cholesterol was quite high.
Right.
And I think a lot, particularly in us ladies, it's something we don't consider.
No.
The word out there, a lot of people are touched by cancer, and we automatically are thinking about that, which is great. Everybody getting everything checked, which you need to keep up with. If you're sent a reminder, please get it checked, because it's always better an early diagnosis, isn't it, than trying to backtrack when things have got out of hand.
Yeah.
But certainly, as we said before, looking after your heart disease is one of the biggest killers, particularly in women. So obviously, my cholesterol is being monitored at the moment, but it can be that it's hereditary.
Yeah.
But again, we can manage that for you.
Yeah, 100%. So yeah, we'll see a lot of people come in to speak to us about maybe advice for weight management, advice on starting new exercise routines, even things like dry January. We will have some patients come in, most likely who'll be wanting some advice on what's the best way to go about these things. If I'm struggling now with sleep, maybe because I'm not having the alcohol, what are some of my options there? Is there anything, what do you think might be the best alternatives to a drink? Is it just water? Should I maybe sparkling water for the fizz?
And it is really, it's gentle exercise, isn't it?
Yeah.
Even just getting outside for a walk can do you the world of good.
Yeah.
Rather than
totally.
spending hours on a treadmill.
I think a lot of people really throw themselves at it head first, and it's so daunting, and you get in there to start this new routine of going to the gym and all this stuff, and it's tough.
Yeah.
And you maybe,
bit
put
intimidated as well.
Put a bit too much challenge on yourself.
Yes, exactly.
It's, you need to gradually build the routine, and then you can, really focus and dial in.
It's actually a lifestyle change, I think.
Yeah.
It's not just a quick fix because, us ladies want to look great in summer.
Yep.
I think it's a lifestyle overhaul,
Yeah.
which, again, going back to that complete health check that we do, we can monitor you throughout the year and see how your progress is. So you've always got a clear picture in your mind and you know what you're aiming for.
Or for the men's side, if a lot of guys are going to be thinking about going and starting at the gym.
Yeah.
A big thing is going to be looking at getting your testosterone checked.
Absolutely.
A lot of people are interested in that, particularly men. You'll see a lot of advertising for it online. I know I'm getting lots of adverts for it online now.
Yeah.
We can look at that and really give you some trustworthy data and results to take away with you. You're not just sending a blood test off to a random lab in the middle of nowhere in the post.
Yeah.
You're coming in, seeing someone, getting some results. Those results are being reviewed by a doctor that the person who took your bloods can speak to in 2 seconds. Do you know what I mean?
Yeah, exactly.
It's all you're looked after a little bit more.
And it's seeing the same doctor, isn't it?
Yeah.
Rather than seeing 10 different people who've then got to go through your notes again, start back from the beginning. And if you're only in there for 10 minutes, you don't get much time at all by the time they found out what's been going on with your health. Whereas here, a lot of our members that come in, they see the same doctor, they've got to know our doctor, it's come quite familiar. And that's a big benefit, isn't it?
Yeah, hugely. Consistency of care does a lot for both the patient and also the doctor. If the doctor can see the same person, consultation, they just get a much better idea of the whole treatment plan, the patient themselves. It's fantastic. And then that just translates to better results for the patient as
Exactly.
well. It's what we like here, is being able to see the same person again and again. Sort of like how your family doctor used to be, you know.
Yeah, I agree.
So yeah, that's all the points that I had really.
I think you've covered everything there, Luke.
Yeah, that was all the research I'd done.
Brilliant.
So I guess the main takeaways being, it's just that time of year where people are going to get ill.
Yeah, exactly.
But we can make life as easy as possible for those people, and we can also give advice on maybe how to avoid it where possible as well.
Yeah.
Make sure that you're minimising time off work, minimising time over the holidays being ill. You know, no one wants to spend Christmas being sick.
Absolutely. Knocked off your feet. No.
Yeah, and it's the time of year when health really does get pushed to the back of everyone's mind.
Yeah, because again, like you were saying, you're rushing around doing this, doing that, and your time is limited. You haven't got much time for yourself.
Yeah.
So obviously over that period, things can take a backseat.
Yep. Which I think the beauty of coming here really is that you've got much longer appointments. You just make one trip, you know, come in for half an hour and away you go with loads of advice, loads of stuff to go away with. You're not having to go and make 3 trips in 2 weeks for 10-minute appointments at your NHSGP, in and out, here and there, all over the place.
And it's an appointment that fits around you.
Yeah.
That suits you and when you're available to come in. And big plus for me is not scrambling to find a car parking space.
Yeah.
You've got a nice free private car park here.
Yep.
And that takes a lot of the pressure off when you're going to see a medical appointment.
Yeah. So I think just try and be mindful of your health over the next few months. You know, don't let anything get on top of you. And if you are starting to feel unwell, or, you know, don't let these things progress, give us a call, come in and see us and get on top of it. It just makes life so much easier.
Yeah.
So much nicer. Yeah.
Exactly.
All right.
Well, thanks very much for that, Luke.
That's all right.
I think that's everything covered. But if you do have any questions, please don't hesitate to get in touch. You can find us on all the usual social sites.
Facebook, Instagram, YouTube, where this will be.
Yeah.
LinkedIn as well. We post regular updates, lots of cool little articles for you to have a look at.
Yeah.
Lots of general health advice that we'll post out.
All our reviews are on there.
Yeah.
And appointments when we have appointments available.
Yeah.
Always look out for those.
Yeah, and you can then use our online booking service, or you can give us a call, or you can email us, and we can always get a consultation sorted for you.
So I guess what we need to, I was going to say that's a wrap, but is that really cheesy?
That's really
because
cheesy.
it's,
because it's Christmas.
Yeah, exactly.
Really cheesy.
But I guess what we need to say is we wish you all a very Merry Christmas and a very healthy Happy New Year.
Yeah.
Bye for now.
Bye.